no, could you imagine? Are we live?
We're
live. We just got the thumbs up from Lydia behind the camera. So we're live. Hello, thank you for joining us on the Eve Appeal channel. My name is Karen Hobbs. I work for the Eve Appeal on the Ask Eve Information Service, and we're at our Talking Taboos event at Mintel, and I'm joined by my baby girl darling, fellow curly-haired sex pot, Dr Naomi Sutton. Hello.
Hello.
Hello, how are you?
I'm very well.
Oh,
wet.
we've missed each other, haven't
We
we?
are.
We're so wet, and not in a good way, guys.
Wet dog.
Wet dog. So you are a consultant physician specialising in sexual health.
Yes.
And our theme at the Talking Taboos event today, which will be streamed live on our Instagram channel at 7 PM if people want to tune in if they couldn't make it down, is all about sex education, kind of sexual health, body communication with younger people, and all of that sort of thing. And Naomi's part of our amazing panel. But we've grabbed her for a few minutes pre-event because we've had some questions from you guys, which is really amazing. And I just want to ask her 11 breezy questions about sexual health. Should we do it?
Rock it, yes.
Do it. And wave if you're watching, because it's always nice to know that we're not alone. Okay, let's do. Well, if you are alone, that's fine, no judgment. Okay, number one. I've had bacterial vaginosis. Does that increase my risk of cervical cancer?
So there's a very short answer to that, is no.
Next question. No, I'm joking. Can you explain what BV is?
So bacterial vaginosis is basically overgrowth of often normal bacteria that are found in the vagina, but they overgrow and can produce sort of a fishy smell and an altered discharge, and it's incredibly common. It's not a sexually transmitted infection, but obviously if you're symptomatic with it, go to your sexual health clinic, have a check. You can get treatment to use over the counter, but again, it's nothing to worry about, and often your vagina will sort itself out, for want of a better word.
The vagina is amazing, isn't it? It kind of looks after itself a lot of the time.
It is amazing, yeah, completely. So no need to panic. There's a lot of confusion over cervical cancer, and I think possibly, or are we going to go on to that a bit?
We've got a couple of questions about cervical cancer, yeah.
I'll park that one, but again, so bacterial vaginosis and thrush are two infections that can occur in the vagina, not sexually transmitted, both of which can just pop up and also can pop away again.
Pop on, pop off. But have got nothing to do with cervical cancer or vaginal cancer or vulval cancer.
No.
They're infections that have got nothing to do with the development of cancer.
Nothing, no.
Great, thanks. Should we have a drink now? No, stop it. We've got more questions here. So number two, I'm 65 and have a history of genital warts. Do I need to carry on having smears or cervical screening, as they're officially known?
So, genital warts and cervical cancer are both caused by a virus called the human papillomavirus, the HPV virus. But there are lots and lots of different types of the human papillomavirus, and they all have different numbers. So if somebody has genital warts, the likelihood is that they've got numbers 6 and 11. I'm just showing off my knowledge of numbers.
And I'm nodding like I'm learning something, but I knew this because it's my favourite subject. 11, yeah. But I'm like, for the people at home, I'm with you.
I've lost my train.
6 and 11 if they've got genital warts.
Yeah, so basically we split the human papillomaviruses into high risk ones and low risk ones. So 6 and 11, for example, are low risk. All they do is cause a lump.
Does that mean low risk, like they can't cause cancer?
They can't cause cancer.
Okay. High risk, cancer causing.
Cancer causing, low risk, non-cancer causing. They just cause lumps like they would a wart on your hand, for example.
I've had warts on my fingers before and had to have them frozen off, so it's the same thing.
Same thing, exactly the same thing, it's just on your genitals.
And it's nothing to be embarrassed about if you're genital warts.
Not.
Yeah.
No. And all dildos have lumps, so there must be a...
Nice segue. Maybe I appreciate that.
There must be some advantage to warts somewhere along the developmental line. So nowadays we test for high risk HPV. So if you go for your smear from they'll test you for high risk HPV, so ones that we know if left over a long time can then lead to develop cervical cancer. So we now test for those, and then if your cells are abnormal as well, then you go on to have a colposcopy. But for this lady in particular, so she's 65, so she's finished her cervical screening. Just because she's got genital warts, the answer would be no.
Yeah, because it's HPV, it's different types of HPV.
Yes, it's the type that we want to talk about. High risk, low risk. Low risk ones just cause lumps and bumps. High risk ones, we could all be carrying them. I mean, this lady could have high risk HPV as well, but we presume at her last smear it was negative.
Because smears stop at 64-ish, don't
Yeah.
they? But if someone's had an abnormal result from that last smear at 64, 65, they're not just going to not see you again. They'll check up and make sure you've cleared the high risk
Yes.
virus causing those abnormalities
Yeah.
in the first place.
Yeah, and about 95% of women will have a type of human papillomavirus in their lifetime. And often we pick them up, we clear them. Again, some people seem to hang on to them for a long time, other people clear them very quickly. So again, even if you have high risk HPV, it doesn't mean you're not going to get rid of it. So the chances are, you know, when you next get screened a year later, you might have cleared it all on your own.
Regardless of your age.
Regardless of your
Yeah.
age. Yeah.
Thank you very much. Next one. Can STIs be transmitted through touching, I guess they mean with hands, a partner's genitals?
Difficult. I mean, the STIs are sort of found within genital secretions. So potentially if you touch your partner's bits and then touch your bits, depending on which bits you're touching, I guess theoretically there's a potential.
So say I put my finger, I'm not going to because we're at work, but say I touched your genitals.
Yes, I
then
can't
touched prepare, we won't live that. I touch your genitals and then I touch myself.
Yeah.
And say you had an STI.
Yeah.
Could I then have given it to myself because I've touched your genitals that have the infection?
So we know there's evidence that women who have sex with women can transmit STIs through sex toys, etc. So yes, potentially.
Is that because they're going in though?
Well, I guess it depends when we say touching. It depends what you mean by touching. If you're going,
they haven't specified.
Exactly.
I wish you had.
I think it's a really difficult one to answer because I don't think there's a lot of evidence either way. I think potentially the answer could be yes, but I don't think it's a common way of transmitting.
Yeah, it's not like oral or penetration.
No.
Okay.
No.
So potentially, but don't panic.
Don't panic.
Don't
yeah,
panic.
Don't panic.
Panic not. Okay. Is it true that a man's G-spot is up his bum?
So the prostate has a lot of nerve endings, and some people have coined that the male G-spot. So potentially
And is that up the bum?
Up the bum, yes.
Yeah.
So it's about 2 inches into the bum hole to the front, so towards the willy.
There's like in and then beckon, hook. Oh, I've heard the sort of come hither motion. You're not laughing, you're learning Instagram. Okay, so hook and forward, but
Hook and forward, yeah. And I think, I think often that whole area of a man is often neglected, and I think men sometimes don't feel comfortable because then they think they're a gay man if they want their bum touched.
I've definitely had straight male partners who've, when I've like offered it on a platter, any type of anal play in any way, it's like, oh no, I'm not into that. And obviously it's fine if you're not, but if it's because you think it'll like demasculate you or...
Yeah, I mean, I think it's all very sensitive around there, and again, it depends on what that man wants to do, but don't be put off if you want to have a fiddle and a play.
So kind of the G-spot, if you want to call it that, for the men.
Yeah, so you can orgasm through prostatic stimulation.
And that is what we kind of talk about when we mean the G-spot, the prostate.
Yes, yeah.
Amazing. So have some bum fun. Go for it. How is HIV tested for, and do you have to tell people you've had sex with if you're HIV positive? HIV is a huge subject, isn't it?
It is. I could talk about this for days.
Yeah.
So HIV is tested on a blood test. You can either go and have a venous sample, or you can sometimes do finger prick testing.
Is a venous...
Sorry, yeah. So what a typical...
She was using doctor jargon.
That's not really.
I've all been to medical school, Naomi.
Yeah, so a blood test. So what anyone would think of as a blood test. And we check for the antigen, which is basically the first sign of an infection of HIV in your body. And that's normally positive by about 4 weeks after the risk has occurred. So
you couldn't go the next day?
No.
Interesting, I didn't know that.
Yeah, so it's about, so gonorrhea and chlamydia have about a 2 week, what we call window period. So say you have sex with someone with gonorrhea and chlamydia yesterday, you're going to have to wait 2 weeks.
Wow, okay, so it's not an immediate
say it's not there. HIV up to 4 weeks, and syphilis is up to 3 months.
So you might think, I haven't got syphilis, and you have got syphilis.
And you have got syphilis.
So blood test.
Blood test, yes. And so nowadays, you know, HIV is no longer a death sentence. People live healthy, normal lives. You can have babies, you can have sex with people. So if you're on effective antiretroviral therapy, which is easily accessible by the NHS, it's free.
So you'll get it if you are diagnosed
HIV positive. If you're on antiretroviral therapy, in 99.9, well, if you take it and it's effective, your viral load will be undetectable, which means you can't pass it on to sexual partners.
So you can still have unprotected sex and for pregnancy and all that sort of stuff.
So and now a lot of people choose not to tell their partner or partners because you know
it's not going to affect them. They can't pass it on. So
and
because there's a lot of stigma around it.
There
still,
is a lot of
there?
stigma, and I think what's really important to think about and for us to question is actually having sex with a HIV positive person who's on treatment is actually safer than having sex with someone who doesn't know their status.
Yes.
Because you know their status is positive, but they're on treatment, therefore they're non-infectious. And they probably have screens every 3-6 months.
And they're being really closely monitored.
Exactly. Whereas, you know, a lot of people don't ever go for screening. So I think the point of today's chat would be just get yourself checked. There's nothing we can't.
And you don't know someone's status, do you, when you first meet? Sorry, we've got people arriving. That's why I look temporarily distracted. You don't know when you can't tell when you speak with someone if they're HIV positive or not, can you?
Definitely not. And there's this preconception, I think, that you'd know or that people look a certain way. And again, we need to get rid of that
all those sort of taboos and stereotypes kind of surrounding.
And also, just to be reminded, you know, 81-year-old people still have sex. You know, we just need to break out of this sort of stereotypical, you know, you'd stop having sex at the age of 45 or something, and you know, just let's stop sort of judging. I think judging a book by its cover.
Be a bit more accepting and understanding. So next question: is there a type of contraception that's the most effective?
Yes. So we split contraception into, well, I guess non-long-acting reversible contraceptive and long-acting reversible contraceptives. That's a very long way of saying that.
Blah, blah, blah. Blah, 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 blah.
Basically, long-acting reversible contraceptives would include the coil, so a hormonal coil or a copper coil.
And you have that in for a while, don't you?
5 to 10 years, depending on what, 3 to 10 years, depending on what type. And an implant. And those are all reversible. They don't affect your fertility long term. As soon as they're taken out, you revert back to normal. But the benefit of those is that you can forget about them, so it's not user dependent. So the injection is in some books classed as a long-acting reversible contraceptive, but again, you have to go every 13 weeks to have that redone.
And haven't we all delayed appointments or gone, oh, I'm due that appointment, I'll go next week or something? And actually, when it comes to contraception, it kind of, you need to go on time if you want it to be effective.
And one thing I would say, if you are taking the combined oral contraceptive, is look at taking it in what we call tricycling or extended regimes.
Pill, combined oral.
So the pill, the combined pill. So there's 2 types of pills. There's progesterone only pill, which you take every single day, and that's how it's licensed. And then the combined oral contraceptive is a one with estrogen and progesterone in. If you can have it and you're on it and you're taking it 21 days, 7-day break, you can forget that and take it continuously.
I think there's this myth, isn't there, that like if you're taking something, you have to allow your period once a month. No, you don't need to.
No, blood doesn't build up in your uterus. It doesn't
and start spouting out, give you a nosebleed or something.
No, you don't suddenly
so you're not going to store up like
fat
3 months worth of menstrual blood and then it will go.
Basically, your endometrium, so the lining of your womb, is kept thin by the hormones, so there is nothing to bleed. So if you're going to take it in an extended regime of some sort, the most common way to take it is to take 3 packs, so 63 days. Check out my maths. Back to back.
Just a pretty face, guys.
And then have a 4-day break rather than a 7-day break. And the reason we're saying 4-day break is actually you've less chance then of your ovaries waking up and releasing an egg. And you only need 7 days to let your endometrium
That's not long, is it? No.
Well, and then, you know, even if you retake it 5 days, 6 days, 7, you know, you're still a better chance. It should be more reliable, and it can also even out your premenstrual symptoms and all these other things.
Yeah, because a lot of people take the pill for sort of reasons other than so I don't get pregnant, don't they? For skin problems and...
Yeah. What we would say, I mean, I would go and talk to your doctor about this if you're going to try it, because ideally you want to be on the lowest dose estrogen that will hold your endometrium. You may get breakthrough bleeding when you first try this method, so don't be worried. But most people, if you're on a standard combined oral contraceptive, I mean, lots of people, I've rolled through 2 packs, so I'm going on holiday, and they tell you like they've done something really dreadful.
I've done that to my GP before, years
really
ago.
Sorry,
I was like,
I did
back-to-backed because I don't want to bleed in a bikini.
Yeah, but go for it. Like, there's
live your life.
Yeah. Well, I think it's interesting. The only reason the pill was licensed that way, sorry, I should say this is off license, but it's absolutely fine. The only way that it was licensed that way is because people felt women would want to have a bleed, and that was like back in the 1950s.
Yeah.
We've
moved on. You can if you want to. Some people like it, but also you don't have to.
And also, it doesn't reassure you that you're pregnant. So people go, I like having bleed because it means I'm not pregnant. No.
Can you bleed when you're pregnant?
Yes.
So actually. And condoms, when used properly,
yes,
they're good, aren't they?
About 85%. Well, I mean...
Mum, I've got to take a test. No, I don't.
Well, the pill's only 9% real life effective. It has a 9% failure rate. Oh God.
For years. We're flashing before my eyes.
Sorry. It has a 9% failure rate.
Yeah.
So, in real life. So it's 1% in the studies, but actually if you look at across the board real life,
actual real life adults taking it.
They forget to take it, which is why, again, this should be more effective. Condoms, they're great, but they split, definitely recommend it for STIs.
Yeah.
Because it's a no-brainer. It's the only thing we have other than PrEP, which is maybe outside of this discussion today, to protect against STIs. So yeah, definitely.
But contraception-wise, in terms of pregnancy, longer lasting,
so
coil implant where you don't have to do anything.
Yeah, or depot.
Okay. Yeah. Next one. As a parent, so someone's a parent. As a parent, how much sex ed is my responsibility? So I think they mean like compared to schools or whatever. What do you think? I guess is it up to them? I don't know. I don't know.
I think parents know their children best, and I really believe we need to, as parents, I think you need to just get with the programme.
You're a mummy, aren't you?
Yeah, and talk about it, and just, try not to be embarrassed, try not to be, mortified. And I know people are, but actually if you introduce it at a young enough age, they just go with it. They've no embarrassment about the word vulva or vagina.
We're trying to do that so much this month, aren't we?
Yeah.
So Naomi's been amazing, kind of sharing all of our Eve appeal, #Educating Eve content about if your child has a vulva, it's fine when you're saying, head, shoulders, knees, toes, vulva, chest, tummy, leg, vulva. It's a visible part of the body. They need to know what their body is called, because otherwise it just leads to confusion and misinformation and problems later on if you're not comfortable or aware.
I heard a story that one girl, because she called it a flower, kept going to nursery saying, someone's touching my flower. And she was actually being sexually abused, and it took months for anyone to realise what she was talking about, because she was calling her vulva, vagina, whatever her area was described as a flower. So, I know that's an extreme version of, but the more...
It shows the impact that correct language can have and kind of time saving in those sorts of serious situations.
Yeah.
So do you think lots of parents think, I'll leave it up to the school because they feel like, I don't know how to tell my son that he'll get an erection?
Again, though, I think you know your child best, and so you know how to deliver it, and I think schools vary. Obviously there's compulsory sex ed coming in next year. But again, it depends who's delivering it. Is it the really embarrassed history teacher who's all equally more...
Who just got it on the rota and is like, it's my turn to do it. My sex ed was crap.
Oh, I was laughing at it. I had a video that was just like a penis going... It's like a two-dimensional...
drawing. And that was it.
Yeah, it's horrendous. And then everyone was in this darkened room, then the video finished and everyone walked out. It was like...
And I'm sure parents would want their kids to have better sex ed than that, and you can't guarantee that it will be anything better than that. So if you can have a go at...
But also, at the end of the day, your children are going to want to talk to you through their entire lives, I think, about their relationships and sex. And, surely that's part of being a parent, is guiding them through all aspects of life, not just...
Because learning doesn't stop at, 10 or 11. It's
like, they've done their sex ed now, thank God that's out of the way. you know, if they get pregnant, for example, I don't want, you know, they'd want to, you'd want them to come to you and talk to you if they feel sex is not part of the conversational menu, for better, you know, that they're going to feel embarrassed and also I think it promotes shame. If you're not talking about it, it's seen as a taboo subject, therefore it's shamed.
It's wrong to talk about it.
It's wrong to talk
shameful,
about it. It makes them then feel, like they shouldn't be, or there's something wrong with it. And again,
and
talk
dirty.
about
I think people feel dirty if they want to talk about sexual things at a young age.
and explain it's not just about making a baby, it's fun. It's amazing.
Oh, I was never taught anything about pleasure whatsoever.
Yeah.
I think that's the same for lots of people.
I remember we had a period video that just went I was like
a loading bay.
Yeah, it was good.
Let's
Great.
have another question.
That's where I learned all my knowledge.
All your good stuff. If I have HPV, will it show up when I go for an STI test?
No.
Okay.
So HPV again.
No, another very blunt answer. So it's
HPV
not
is the human papillomavirus again. So there's no way of us testing it. And anyway, even if we did biopsy your bit of skin, it may be an adjacent bit of skin. There'd be no clinical reason for it. So unless you, even if your partner has genital warts, for example, or high-risk HPV, there's no point you coming for come for a checkup, obviously, but we're not going to add anything if you can't see any lumps or bumps.
Yes. So even though it's passed on through sexual contact, sexual activity, like actual STIs, because most people will get it, any type of sort of sexual touching can pass it on. You can't test for it unless it's kind of developed into genital warts, or you go for your screening.
Screening's the only time where we actually test for it via a swab test.
But when you go for an STI check, you won't get tested for HPV.
No, and the only way we say it is or isn't is I look at it and I go, that's a genital wart. I'm not telling you whether it's type 6 or 11 or something.
But that's because the HPV's turned into something, isn't it?
Yeah, and most people carry it without having ever having any symptoms.
Okay. And can I have a smear test or cervical screening and an STI test at the same time?
Yeah. So gonorrhea and chlamydia testing now done on a self-taken vulva-vaginal swab for a female. First bit of wee for a man is so easy. I mean, the nurse or doctor could do it at the same time. Just ask them. Sometimes it's not always offered.
Wouldn't it be great if more practices or tests and things combined sort of other chats and other things about, like when you go for your cervical screening, wouldn't it be great if you thought, I'm a bit worried about that lump around my clitoral hood? I mean, I'm sure you could say something, but you can't guarantee that you'll get something out of that conversation at the appointment because you are there for a cervical screening.
I also think a young girl going for an asthma check, for example, should be offered chlamydia testing, gonorrhea testing, because she's under 25 and sexually active. Just offer it, just get tested when it's available. And if it's not offered to you, just say, whilst I'm here, can I do an STI screen? You don't even have to get your genitals out. You don't have to get up on a couch. No speculums. Obviously, if you're having a smear, it's a speculum, but majority of the time, it's just in the loos.
Oh, what a lovely image for everyone at home.
I know.
So ask, basically. So sometimes, yes, you can ask the question. Are there symptoms for chlamydia?
Yes, but majority of people won't have them. So 80% of women who we see with chlamydia won't have any symptoms at all.
So you just don't know?
No.
So it's when you have to get checked?
Which is why screening for all STIs can be asymptomatic.
Really?
As in not have symptoms. Syphilis, HIV, gonorrhea, chlamydia, HPV, HSV.
So you could be riddled and not know until something super serious happened.
I love that word.
I'm sorry, riddled is.
Well, we're all riddled with HPV and HSV. There's that's the herpes and the HPV virus.
Is that where people get cold sores?
Yeah.
The HSV.
Herpes simplex virus. So having that is a state of normality. So we need to move away from this.
There's definitely a sort of I'm dirty, I've been bad if I've got this thing around my mouth, and I know I've had friends that have been mortified if they've had a cold sore.
Dirty is not, when we talk about sexual health, it's not a matter of personal hygiene, is it? Clean and dirty doesn't make sense. at all, because nobody knows what they've got. We've already talked about the fact that you can be asymptomatic with all these things. So yeah, the point of that is, so symptoms, if you do have them for chlamydia, can be a change in your discharge for ladies. It can be pain or burning when you pass urine for men, and sometimes men can get a bit of a discharge. Again, any change that people notice, go and get it checked out.
But most of the time won't show.
80%, yeah, 80% for women, about 50% for men, no symptoms.
And which leads nicely on to our last question. How often should I have sexual health checks?
How long is a piece of string? So I guess it depends how many people you're having sex with. So if you're...
I'm not grinning loudly to decide other people came in again. I'm not just like...
Depends how many people you're having sex with. If you're having lots of different sexual partners every 3 months, if you're in a long-term relationship, you know, and you go for your pill check, just have a screen whilst you're there, because again, you don't know what your partner's doing, and I hate that. I don't want to put a non-trusting vibe on anything, but
just look after yourself.
Yeah, look after yourself, because we don't.
And what about if someone's a sex worker and have got lots of clients kind of every day, then...
So often, sex workers will often be very good with condom use. So again, every 3 months.
Because it's a business, isn't it?
It's a business, yeah. Every 3 months is, you know, generally more than adequate. If they're not using condoms, obviously, you know, more often. But yeah.
Thank you.
My pleasure.
Thanks very much for watching, everybody. We'll be back at 7 p.m. for the live panel, which Naomi is a very important part of. If you've got any other questions after this, because we're going to say goodbye, then the Ask Eve service that I run with our gynae nurse, Ask Eve, can be reached by a nurse at eveappeal.org.uk. And we're going to upload this to IGTV tomorrow if Lydia behind the camera has enough download space on her phone. So we'll see what happens. Thank you for being a babe.
My pleasure.
Bye, thank you.
Bye.
How long was that, Lydia?